You may be asking why we only do the sleeve gastrectomy, and we do it because I feel like it's a very safe operation and a very powerful tool to help people change their eating habits. It's a powerful tool because there's chemical changes that happen by cutting out that part of the stomach. When we do the sleeve gastrectomy, we basically cut out 2/3 of the stomach. That leaves the upper 2/3 in a tube shape. That's why we call it a sleeve. And the lower third is still normal. Those chemical changes make it a very powerful tool to help people change their eating habits. I think my story is even very compelling of why I've shifted just to the sleeve gastrectomy, because I started doing the gastric bypass laparoscopically when there were very few surgeons doing it. That was January of 2000. And I did a couple of thousand of them with very, very good results and very low complication rates. In 2002, I was one of the first 5 doctors in Texas approved by the FDA to do the lap band. And the lap band became very popular primarily because it was safer than the gastric bypass and people were choosing it. It wasn't near the tool, the powerful tool, as the gastric bypass, but it was a safer operation. And people in life get to choose the amount of risk they want to take in their life. And people were choosing the lap band as an option. In my practice, about 60% of the time it was the lap band, and about 40% of the time the gastric bypass. In 2008, I started doing the sleeve gastrectomy. At that point, we really didn't know how powerful of a tool it was. We really thought it was going to fit somewhere between the lap band and the gastric bypass as a procedure choice. But over time, we realized that we were getting these powerful chemical changes, much like we got with the gastric bypass, also with the sleeve gastrectomy. So we realized that it really was a powerful tool. But the interesting thing was, with the sleeve gastrectomy, people tend to eat a lot more normally. They rarely threw up or spit up. But they also, that those chemical changes that would produce that almost addictive drive toward food, that where food was almost calling your name, would disappear. And those kind of things really, along with the fact that you would get full on a small amount of food, would really act as a powerful tool. Now we combine that with helping you change your eating habits for kind of a year-long program. So because I became very good at helping people change their eating habits, and this was a very safe operation, the sleeve gastrectomy, that would help people eat fairly normally, but also was a powerful tool to help them change their eating habits, now it's the only procedure that I'll do. I frankly would kick myself if I did a gastric bypass and a person had a complication. Now, I did them for many years and had very low complications, but even in the best of hands, there's going to be a serious complication somewhere around 1 in 200, 1 in 500 range. Now, that's a fairly low complication rate, but when they happen, they can be a big deal complication for the surgeon and particularly for the patient and their family. We are usually able to get people through those complications, but the sleeve gastrectomy is safer than doing gallbladder surgery. Its safety track record in experienced surgeons is safer than the track record that gallbladder surgery has. So when you combine the safety of the operation, that it's a very powerful tool, that you get these chemical changes that really helps you get this work done, combine that with really good eating habits, that's why all I offer today is the sleeve gastrectomy.